Hi everyone, welcome to another interRAI in Conversation podcast. My name's Len Gray and I'm a professor in geriatric medicine and an interRAI fellow. Today I'm interviewing Bonnie Pim, who is a research nurse at the University of Queensland and works as a nurse at the Princess Alexandra Hospital in Brisbane. Bonnie, thanks for joining me today.
Thanks very much for having me, Len.
It's a pleasure. So Bonnie, tell me about your current role and the organisations that you're working for.
Currently, I have several positions. I am a research nurse with the University of Queensland. I'm a clinical nurse with Princess Alexandra Hospital in the geriatric assessment team. I am involved with interRAI in the Network for Acute Care and also the interRAI training committee.
Good to hear. So Bonnie, I know you've had a lot of experience in using various interRAI systems. Would you like to tell us something about the systems you've used and the contexts in which you've used them?
Yes, I've used multiple instruments. In my role as a research nurse, I've used everything from the acute care through to home care, through to the checkup instrument and also the long-term care instrument. I use those in the context of various projects that we get funding for all around the country. In my role as a clinical nurse, I have extensively used the Acute Care Comprehensive Geriatric Assessment Instrument, or the ACCGA, and that formed the framework for our geriatric assessment team and the service that we have there running at the hospital as well. As far as the training committee goes, we train on any of the instruments that anyone needs training on, so I am familiar with all of them.
Thanks, Bonnie. What about training? I know you've been doing this for a long time and you've probably learned on the fly to some extent, but what training did you actually get along the way?
Many, many years ago when I first started using interRAI, you're right, it was on the fly. It was with another research-based nurse who was using it at the time. It was a couple of hours just going through the instrument and then we were let loose on the ward. But over the years, as we've sort of integrated it into services and used it more and more for different projects, I've had the fortune of being closely involved with many interRAI fellows and also geriatricians and other people using the instruments over the course of years and throughout different services. So it's been a really interesting and valuable journey, learning from those people as well about what works with training, about the needs of people who need training, but training is definitely an integral part of the interRAI systems and instruments.
Great. I'm really interested in your experience in using interRAI systems in the hospital context. I know you've done a lot of that, and I know not many people have used interRAI systems in hospitals, so I think many of the listeners would be interested to hear how you have personally used these systems and how it works in the hospital work that you've done.
The service that I actually use it in, as I mentioned, it forms the framework for that particular service. So we get referrals in. We're called the Geriatric Assessment Team through eHealth. We receive the referrals, and then as a clinical nurse who's been trained in interRAI, I will actually go and see the patients who have been referred. And that could be for inpatient rehabilitation. It could be for geriatric consult if they're quite complex or have been in hospital for some time. It's also used as a referral for triaging into our aged care assessment services, which is a Commonwealth service for people who are going into residential care. So it can be used in many and varied ways. It's quite flexible in that sense as well. But as a nurse, I will go and see the patient, perform the assessment, and then we'll actually do rounds with the geriatrician and the medical team as well. So it can then be used to make triage decisions about what's best for the patient.
Good. Now, I recall that you've provided that kind of service both with and without the use of interRAI systems to kind of underpin assessment. Tell us what the advantages and disadvantages might be of using an interRAI solution as opposed to whatever may have been a kind of previous practice.
So previously we did use just paper forms. They were many and varied. They were usually developed by nurses on a Friday afternoon, and it was just literally a snapshot of information that they wanted to collect, and sometimes you would have other information added from other disciplines. It had variable information, it had variable formats. There was a lot of duplication with other assessments that were being performed at the time. You could get responses from one word through to 5 paragraphs. So it wasn't exactly streamlined. It didn't help our workflow at all, not having this wonderfully robust, evidence-based, standardized assessment instrument that inteRAI provides, essentially. So it's incredibly comprehensive. You can trust the information that you're actually receiving, provides a minimum standard for all of the assessments that are being performed, and it can be used by the multidisciplinary team.
I think you have had some exposure to using the inteRAI acute care system, which is designed for primarily nursing assessment at arrival at hospital. How do you see that being used in a hospital, and how would that help both the nursing process and also the interaction with the assessment service?
Yes, you're right. The AC, or the acute care instrument, is a much shorter instrument compared to the acute care comprehensive one. So the way that I would actually see that used, and the pilots that we've actually done, would have that implemented when a person gets admitted to a ward as opposed to an emergency department. So as soon as the person it's deemed that they're going to be admitted to the ward, then you would perform this sort of 15-minute assessment. And it's basically a psychosocial and functional assessment, which can then help for you to formulate a care plan and provide ongoing care for the patient themselves. It also will produce things like risk screeners, fall screeners, pressure injury risk screeners, et cetera, et cetera. So that can also help care right at the start of the person's admission, which obviously you don't want to leave too long. So it's collecting the information really early in the person's admission and using it for ongoing care.
inteRAI systems are often thought to be long, burdensome. You look at the paper and it looks like a big job. What are your thoughts about that?
On the contrary, I think if inteRAI assessment instruments are used properly and in the spirit they're actually designed for, the mantra of inteRAI is actually to collect the information once and use it many times. So if you're only collecting the information once, it actually decreases the burden that you're probably used to, because currently, like a lot of places, will collect information on different forms or on different software sites, and it actually does create a lot of burden for the assessor. So if you're only collecting the information once, it will actually decrease the amount of time you're using. It decreases the burden on the patient as well, or the client, and it can actually be used to improve your workflow, especially if it's integrated with other systems that are being used.
So what about the patients? Do you think inteRAI assessments are beneficial to the patients, or are they just a documentation exercise for the clinicians and for the administrators?
I think the inteRAI assessments are really beneficial for the patients. Unlike some of the other assessment instruments that are used, or the paper-based forms that have been developed, these ones they're really comprehensive. So you're collecting all of the information at the one time. So that actually does decrease the burden on the person. You don't have all of, people having to come back and ask them different things. It's actually designed as an observation system as well. So it directs you to use collateral from other areas rather than just a tick box form, which is like some of the other assessments that we see in hospitals. And I think it is actually quite beneficial for the patient as well.
Bonnie, when you're doing assessments, do you feel you're working for the older person, or do you think you're working for the hospital, the health system, or the government?
I don't think they're mutually exclusive, to be honest. I think primarily for the older person. Obviously, as a nurse, I'm there, to hopefully make a difference to that older person and give them the best outcome if they're in a hospital scenario. But I also think that it can work for the hospital as well, because if you're getting that robust assessment, identifying problems earlier, implementing care, in a really structured and systematic way, and getting it frequently as well, so that, you can pinpoint if something changes, then it can work for the health system as well, in that, hopefully it can decrease the length of stay for them. But, obviously the patient is the one that I'm there for, but fortunately inteRAI will actually do everything for everyone. So it can actually, benefit the patient, the healthcare system, and, the government if they were inclined to use it.
What about software? How do you think about software? Is it important to the process, or is it just something that's there for data collection? What's your thinking about that?
Software, I think, with inteRAI instruments is actually a critical piece. Not only does it have analytics behind the screen, so inteRAI systems are designed to be electronic, so they will produce things like those risk screeners, like diagnostic screeners, like areas that we can concentrate our care on to improve outcomes for these older people, or for patients in general with the acute care instrument. So yes, software is really critical when you're actually implementing these particular instruments. It's good to have it, in a readable format, something that you can use to provide organic, up-to-date information. So if a change occurs, it's really handy to be able to just, jump in that software and hit the button or select the item that has changed, and that will then regenerate all of those risk screeners and diagnostic screeners, etc. So it can make your life a heck of a lot better.
In regard to software, Bonnie, if you were to select software from a vendor or the hospital were to be building software, what sort of features would you look for in an inteRAI system that you would want to see?
I would look at what instrument I'm using first up, because depending on the instrument and how frequently you're actually updating the information, I would want my software to be very reactive to those needs. So, if I'm doing a shift by shift assessment, that's very different to actually an assessment that's being collected every 3 months. So I would want software that is reactive to my needs, that can suit the environment, that can be updated regularly, that feeds into my care planning. So if there's something that is, a problem, as far as the assessment goes, or a potential problem for the patient, then I would want that alerted on my care plan as such. So I think that's really important. You want to be able to write notes for particular areas as well, because obviously not everyone fits in the same box. So it's important to have space to write notes as well. And you want something that informs any of the other systems around it. You don't want a standalone system, because we know from experience that people will not have, log into software that, doesn't necessarily integrate with other systems that they're already using as well.
There are thousands of clinician assessors out there doing inteRAI and not inteRAI work, but when it comes to inteRAI, what's your advice for a clinician assessor who's being introduced to inteRAI for the first time? Have you got any kind of thoughts, tips, tricks, or anything you'd like to say about that?
Yeah, I would say definitely give it a chance and become familiar with it. Use it as much as you can, and use it. We have a saying in our training committee, use it until you are competent and confident. It is probably different to any assessment system that you've actually used, particularly the tick box sort of style ones. So these, have lots of definitions and they really are quite robust. So yeah, get familiar with it, let it work for you, use it in its entirety. So all of those outputs that it produces, use those to help plan your care and to help improve outcomes for the older person.
One of the advantages inteRAI speaks about is being able to share assessments across settings. For example, people coming from let's say a residential aged care facility into hospital. What's your experience of that, and what do you think the advantages are in using inteRAI to communicate between providers who are transferring care or sharing care?
Yeah, I think it's a definite benefit if you're using inteRAI instruments that can actually transfer that data across different care settings. Particularly with hospitals, it would be incredibly beneficial for us. If you've got that, someone's collecting the data and it's actually being fed across care systems so that it decreases the burden on assessors, it decreases the burden on the client themselves. So, you don't have the same questions being asked as they're moved or transitioned through the various care settings. There's obviously data sharing between organisations and different care settings as well as that person transitions, and it can form the framework, of their ongoing care regardless of where they are.
Do you have any other advice about how best to use inter-rai systems?
I would recommend that if you are thinking about implementing inter-rai systems or a particular instrument, that you implement it fully, and that would include having the training performed properly, use the right software in whatever setting that you're actually doing it, collect the information across all of the timeframes and multiple times as well so that you can do the comparisons, you can get different profiles for that client, you can identify change early as well. And obviously that's going to not only improve the quality of care that you provide for your patients, but just quality improvement in general and efficiencies across your organisation.
Currently, there's very limited use of inter-rai systems in Australia. If Australia were to adopt inter-rai systems at scale, what benefits do you see for clinician assessors in using inter-rai?
I think it would be incredibly beneficial for myself as someone who does multiple different types of assessment. If we actually had a inter-rai as the framework, it would decrease the burden on us as assessors. You could use that data to transition across the different settings as well. For example, if you have someone who comes into hospital, you could do the acute care instrument, then you could perform, a post-acute care or a comprehensive geriatric assessment. If that person was then deemed to go on to have an ACAT assessment because they needed to go into residential care, if inter-rai was being used across different care settings and mandated by the government, then all of that data that's already been collected could actually help to populate that, or at least be used in the context of fulfilling that assessment. And then you can actually use it for ongoing care in long-term care facilities if they were using inter-rai. So, it could be incredibly streamlined. It would just the burden on assessors themselves, it would be fairly incredible.
So do you have any advice for the Australian government?
Implement inter-rai.
Bonnie, thanks for joining me today.
Thanks very much for having me, Len.
For those of you listening to this conversation who may have further interests in inter-rai systems, please visit our website, interrai-au.org.